Good morning everyone. Myself Dr. Devangi Dwivedi, Senior Lecturer in Oral Pathology and Microbiology Department. Today I'll tell you about skin disease Pemphigoid. So Pemphigoid is a group of relatively uncommon autoimmune vesiculobullous lesion. It is characterized histologically by subepithelial bullae formation in the basement membrane zone of skin and epithelium. So there can be two types, bullous pemphigoid and cystitial pemphigoid. First, let's take up bullous pemphigoid. So bullous pemphigoid is a chronic autoimmune subepidermal blistering skin disease that rarely involves mucous membranes. It is characterized by the presence of immunoglobulin G autoantibodies specific for the hemidesmosomal bullous pemphigoid antigens that are BP230 and BP180. IgG autoantibodies bind to the skin basement membrane and activate complement and inflammatory mediators. Activation of the complement system is thought to play a critical role in attracting inflammatory cells to the basement membrane. These inflammatory cells in turn are postulated to release proteases which degrade hemidesmosomal proteins and lead to blister formation. Eosinophils are characteristically present, although their presence is not an absolute diagnostic criteria. Next, coming to the clinical features, bullous pemphigoid is basically a disease of elderly persons. It can occur earlier in life. There appears to be no gender predilection. The cutaneous lesions begin as a generalized non-specific rash, commonly on the limbs, which appears urticarial or eczematous. It may persist for several weeks to several months before the ultimate appearance of the vesicobullous lesions. The vesicles and bullae arise in these prodromal skin lesions as well as in normal skin. In addition to the occurrence on the limbs, the abdomen is frequently affected. These vesicles and bullae are relatively thick-walled and may remain intact for some days. Rupture does not always occur, although when it does, it leaves a raw, eroded area which heals rapidly. Next, I'll tell you about the oral manifestations. Oral lesions occur far less frequently in bullous pemphigoid than in cystitial type of pemphigoid. These oral lesions of bullous pemphigoid are usually described as vesicles and areas of erosion and ulceration. An important feature of the oral involvement is the similarity of gingival lesions to those of cystitial pemphigoid. These gingival involvement generally involves much, if not all, of the gingival mucosa and is exceedingly painful. The gingival tissues appear extremely erythematous and may desquamate as the result of even minor frictional trauma. The vesicles and ultimate erosions may develop not only on the gingival tissues but in any other area such as the buccal mucosa, palate, floor of the mouth and the tongue. Here we can see the clinical photo for bullous pemphigoid. Next, coming to the microscopic features, the vesicles and bullae in this disease are subepidermal and non-specific. There is no evidence of acantholysis of epithelial cells. In fact, the epithelium appears relatively normal. The vesicles contain a fibrinous exudate admixed with occasional inflammatory cells. Electron microscopic studies have shown that in contrast to cystitial pemphigoid, the basement membrane remains attached to the connective tissue rather than to the overlying separated epithelium. In addition, the ultrastructural studies have shown that the primary changes in bullous pemphigoid appear to occur in the connective tissue where the blood vessels show alterations in their penetrability. The basement membrane also shows thickening with interruption of continuity. The circulating basement membrane zone antibodies have been found by the indirect immunofluorescence technique in about 80% of patients with this disease. Here you can see the histological picture for bullous pemphigoid. Next, coming to the treatment. The goal of therapy is to decrease blister formation, to promote healing of blisters and erosions. Therapy must be individualized for each patient, keeping in mind pre-existing conditions and other patient-specific factors. Most patients affected with bullous pemphigoid require therapy for 6 to 60 months, after which many patients experience long-term remission of the disease. However, some patients have long-standing disease requiring treatment for years. Next I'll tell you about cystitial type of pemphigoid. So it is a rare chronic autoimmune blistering disorder which can produce scarring. It can affect the skin only, mucous membrane, or in many cases both can be affected. Patients have antibodies detected to 180 kD bullous pemphigoid antigen, laminin 332 and beta 4 antigreen. Next, coming to the microscopic feature, there is subepidermal blister with dermal lymphohistiocytic infiltrate with variable numbers of neutrophils and eosinophils. The treatment may involve topical therapies and in some cases calcineurin inhibitors are also given. So that was all. Thank you.